Welcome, welcome, welcome. We're so happy to have you here for our monthly webinar series. I am Allison Ali-Sekera. I'm with the Director of Training and Technical Assistance here at the Association of Clinicians for the Underserved. If you are here to find out about rural recruitment innovations through partnership and collaboration, success, you are in the right place, and we are so happy to have you. We have a lot of fun, a lot of excitement scheduled for you today. But first, just a few words on housekeeping and kind of how we got here. This webinar is being hosted by the Association of Clinicians for the Underserved through our workforce project called the STAR Center. The STAR Center is funded by the Bureau of Primary Health Care to provide free resources, training, and technical assistance to health centers in all things clinician recruitment and retention. We are one of a national network of about 20 cooperative agreements. So you can just Google the phrase National Cooperative Agreements to find out more about other organizations. And you can visit us at www.chcworkforce.org for more information on lots of cool tools that we're putting out regularly, as well as other webinars like these, in-person trainings, and how to get free assistance. So you're talking to me right now. I handle a lot of our training and development, and here's my information as well as the ever-efficient staffer Mariah Blake. Her contact information is here. We encourage you to get in touch with us anytime, but especially during today's webinar, if you're having any challenges connecting or hearing, you can just email or chat Mariah in the GoToWebinar box, and she will do her best to help you. We also love chatting with and hearing from you all on Twitter, so feel free to follow us. Our handle's there, and if you want to chat during this webinar, you can use the hashtag ACUchat. So we are recording officially, so just be forewarned. We also have handouts available for you right now. So if you look at your control panel on the right side, you should see a little box that says Handouts. Inside is some information about us, and you can also download copies of today's presentation in case you like to print and follow along, or in case you want to share them with people later. Please feel free to ask questions at any time. There's also a little box that says questions. You can type those in during the presentation or near the end, and we will answer all those questions verbally, sometimes throughout, but definitely we'll save some time for the end. And don't remember to have fun. We have a lot of interesting, cool ideas for this webinar, and we're very excited to have you here, and we want you to be engaged and enjoying yourself. So I'm very pleased to introduce Nathalie Preptit. She is the Director of Outreach and Services and Partnership Engagement at the Tennessee Rural Partnership. The Tennessee Rural Partnership, you're going to hear a lot about them, but they're a healthcare workforce network designed to maximize access to primary care in rural and underserved communities. And they're doing a lot of really interesting things around recruitment and retention, and I think you're going to like hearing from them. So without further ado, I'm going to turn it over to Nathalie.
Good afternoon, everyone. Thanks so much for joining us today. My name is Nathalie, and I'm the Director of Outreach Services and Partner Engagement at the Tennessee Rural Partnership. And during today's webinar, we're going to be discussing the growing healthcare workforce shortages, partnerships with academic training programs, innovative aids to rural practice, state partnerships, and HOSA collaboration. It looks like I don't have control of the PowerPoint. Oh, there we go. But before we get started, I just want to poll you guys on a quick question. I have proper tools and resources to recruit primary care providers, true or false? Recruiting for primary care providers is a multifaceted undertaking, and having the right tools and protocol in place is very important to the outcome of your efforts. So I just want to get a quick feel for how many of you have those protocols in place. Okay, so it looks like about 44% of you say true that you do have those in place, and then 56% of you do not. During today's webinar, I hope that we can provide you guys with some helpful tools and some helpful information to get those protocols started and help you with recruitment and retention of your primary care providers. The Tennessee Rural Partnership is a private not-for-profit workforce network that was founded in 2006 by the Rural Health Association of Tennessee and the state's 4 allopathic medical schools with primary care residency programs, as well as other key stakeholders to address the increasing challenges of providing health care in rural and underserved areas across the state. Our mission is to maximize access to primary care in rural and underserved areas in Tennessee. We assist in the recruitment, placement, and retention of physicians and other health professionals, and this is done without any charge to the candidate or the community. Primary care physicians, nurse practitioners, and physician assistants are matched with jobs in rural and underserved communities. We're kind of seen as the Match.com of rural clinician recruitment. In 2012, TRP became an operating subsidiary of the Tennessee Hospital Association, and this partnership has allowed us to expand our reach and to integrate our overall mission to fulfill the workforce needs of communities in our state. Our workforce partnership with the Tennessee Primary Care Association has given us a platform to connect with our membership on a more in-depth level. As stated before, TRP is a workforce network comprised of many different rural healthcare entities from medical schools to state and national associations. Because of these partnerships and relations we have cultivated throughout the past 10 years, we're able to achieve our mission. Healthcare is an ever-changing mechanism, and the challenges of filling the gap grow greater every day. The only way we're going to fix the problem of access to care is through active partnerships and collaborations with both state and national organizations who are also aiming to combat the primary care gap. We can all agree the greatest shortages of doctors today are primary care physicians and other generalists. We have study after study telling us that finding a primary care doctor is highly problematic, and that nearly 60 million Americans, almost 1 out of 5, live in regions that are considered underserved by the federal government. For every 100,000 people in the United States, there are 91.3 active primary care providers. The chart on the left has broken up the primary care physicians by state and degree type, with the median provider per 100,000 being 90.3, excuse me. How does your state stack up to the national median? Are you guys on track to reach that, or are you falling behind? This next map demonstrates the shortage by displaying the federally designated primary care areas. I find this map to be particularly helpful because it's a visual, just a visual display of the shortages and challenges that we're all facing. In Tennessee, we face many challenges when it comes to bridging the primary care gap. A majority of our communities and counties are considered to be rural underserved, with designated pockets of urban underserved areas. Each of our grand divisions face starkly different health disparities and geographic issues. By working together with our partners and other state entities, we've begun to address some of these issues. We work with a variety of healthcare practice types. Some of these types are departments of health, small and rural hospitals, private practice, community health centers, and many others. For the practices and communities that we work with, We provide primary care candidate sourcing, financial aid incentives, and tools and resources to help with the retention and recruitment process. For the providers, we provide and match them with available job opportunities in our database. We help to facilitate rural exposure opportunities such as rotations, as well as educational tools and special events. All of these services are free to both the communities, opportunities, and candidates that we work with. In working with communities and opportunities throughout the state, we're able to provide candidates with a wide variety of rural practice types. These arrows indicate some of the opportunities that we work with and where they're located throughout the state. Building relationships and a sense of community is the backbone of our work. We make sure that we're building sound connections with each of the communities and opportunities that we serve. This level of connectiveness helps us to better understand the needs of those communities that we serve. Next question that I have for you guys is, how do you recruit for primary care providers? There are a lot of different techniques when it comes to recruitment. The goal is to communicate and share those techniques that you use and talk about what's worked for you in the past and what hasn't worked. Okay, so it looks like a lot of you use a combination and a lot of you don't recruit, or you don't know if you recruit or not. And that's something that we hear often. Recruiting, it's like I said before, it's multifaceted, and it takes a lot of effort and a lot of time and a lot of resources. And we're going to continue to talk some of those efforts and resources as we go on during this webinar today. As with the communities, we also work to have a strong foundation with our candidates. We make it a point to be where these potential providers are so that we can build these relationships. TRP is actively engaged with medical students, primary care residents, and health professional students in our state. We go to noon conferences and provide lunch and educational presentations to the residents, as well as participate in state and national conferences and provide rural exposure experience to medical students, nurse practitioner, and PA students, as well as high schoolers. We facilitate rural exposure experiences by providing rotation opportunities to the residents. These rural rotations are dually beneficial to both the candidates and the opportunities and the communities. Rotations give candidates the opportunity to experience a rural practice setting and give the facility a chance to highlight themselves, as well as actively recruit and engage with primary care residents. This is Dr. Jamie Johnson. He's one of our rotation participants as well as a placement. Dr. Johnson is a great example of someone who never thought that they would go into rural medicine. He grew up in the suburbs and attended training in Nashville. But because we took the time to cultivate our relationship with him, Dr. Johnson is now practicing in a rural area. His decision to practice rural medicine is the direct result of collaborative efforts. This is why we place so much emphasis on building strong relationships with both our candidates and our communities. To expand our scope of services, we partnered with the Tennessee Primary Care Association to create the Community Health Educational Experience for Residents and Students, also known as CHEERS. This program is designed to provide health profession students with community-oriented primary care rotations in medically underserved areas. This collaboration allows community health centers an opportunity to showcase their facilities, as well as provide rotation aid and the ability to actively recruit for future providers. Another tool that we use is our Rural Exposure Weekends. Our Tennessee Rural Partnership, Tennessee Rural Perspectives Weekend gives both the participants and the community a unique opportunity to interact. The medical students and residents get a chance to be surrounded by like-minded peers, ask questions they typically wouldn't have the opportunity to, and it also gives them a chance to experience different rural practice types. They get to hear and see firsthand what it would be like to be a rural practitioner, and the community has a chance to showcase the positive aspects of practicing in their setting. Some of you may be thinking to yourselves that this sounds like a lot of work, a lot of time, and a lot of effort. And you're right, it is. But there's a reason why we do what we do, and there's a method to the madness. Since 2006, we've placed 116 providers in 54 counties in Tennessee, with 83% of them remaining in rural. And none of this would have been possible without our partnerships and collaborations. Financial incentives are also a very helpful tool when recruiting providers. We realize that there are financial hurdles for many of the communities that we work with, so we created the TRP Community Incentives Program. This program is for communities who've been recruiting for primary care providers for 2 or more years, or who find themselves in immediate need for a provider. The incentive allows the community to receive up to $30,000 to help them with their recruitment efforts. The money can be used for provisions such as helping to improve the benefits package, offering the physician a sign-on bonus, and much more. We also have the Tennessee Partnership Stipend Program, as well as the Nurse Practitioner and PA Incentive Program. The stipend program is offered to primary care residents. They receive $30,000 for each year of their residency, and they're just agreeing to work in a rural or underserved area upon completion of their program. Our NP and PA Incentives Program is for NP and PA students. Students interested in this program are required to do a rural rotation while in training, and upon completion of their program, go to practice in a rural or underserved area in the state, and can qualify to receive up to $25,000. Other financial incentives and programs that we have available in the state, we have our Tennessee State Loan Repayment Program, which is administered through our Department of Health, and the National Health Service Corps Loan Repayment Program, which is administered through the federal government. Both of these are great aids and great opportunities to utilize, especially when you're trying to recruit a primary care physician in a hard-to-recruit area. The key to successful partnerships is clear and constant communication with your partners and stakeholders. We work closely with the Department of Health and participate in monthly workforce meetings. They're also our state's 3R Net organizational members. Like stated before, we're workforce partners with our primary care association. And this partnership, we've worked very hard to keep it active and engaged so that we can provide resources to their members. How many of you are actively engaged with your primary care association? If you don't have a relationship with your primary care association, I encourage you to take the steps today and start building that relationship. PCAs have great resources for you and your facility to help with your recruitment and retention needs. That's great. I'm glad to see that so many of you have a partnership with them. It's a really important one to have, and just staying connected and making sure that you are utilizing that tool and resource. Our partnership with the Tennessee Academy of Family Physicians not only allows us to stay connected with family practice doctors in the state, but it gives us a platform to reach family medicine residents and medical students who are interested in family practice. We participate in state and national conferences, as well as have representation on our board. We recognize that building a pipeline is also a very important piece in combating the growing primary care shortage. We've partnered with the state host of Future Health Professions program to create the TRP STAR Scholarship Program. The STAR program provides an opportunity for high school students in high school health sciences to shadow a local physician to learn more about daily practice of a rural provider. When students have completed an 8-hour rotation, they receive a $500 scholarship. We also host a symposium twice a year, giving high school students the opportunity to spend the day in a simulation lab learning about medical professions and meeting peers from across the state who are also interested in going into the medical field. I have one last question for you guys today, and it's I partner with other entities in my state and nationwide to help me with my recruitment needs. Great. You guys are on top of things. I like to see these high numbers. For me, if there's one thing to take away from today, it's that partnership should be top of mind in your organization. Through connecting with other entities, both state and nationally, it gives you an opportunity to share resources and tools, and that can help you combat your workforce challenges that we are all facing. So just some quick takeaways, some highlights and challenges that we face here in our office. You know, building those trusting relationships are so important to the work that we do, and it's the bread and butter of us providing these services to the communities and the candidates that we work with, and placing these physicians in rural and underserved areas in the state, as well as providing these resources in our strong collaborative efforts. And I think we could all agree with the challenge of not having enough hours in the day. That seems to be a problem that everybody's facing, and limited resources. But I strongly believe through collaboration and keeping an open line of communication that we can start to combat some of these issues that we're facing and will continue to face in the future when it comes to healthcare workforce needs. Thank you for participating in today's webinar. And if you have any further questions, please feel free to contact me. I'd be more than happy to help answer any further questions that you guys have. Or I would love to collaborate with you guys if you have any ideas on how we can partner and work together.
Thanks so much, Natalie. We actually already have some questions kind of lined up coming in. Could you spend a couple minutes and talk about how the Tennessee Rural Partnership is funded and how you're able to support a lot of these activities?
Yeah, so the Tennessee Rural Partnership is funded through TennCare and also through the hospital. Yeah, the hospital assessment fee. I'm so sorry. The hospital assessment fee. Us being a subsidiary of the Tennessee Hospital Association, like I said before, has really helped us expand upon some of these services that we're able to offer both our communities and opportunities that we work with as well as the candidates.
Great, thanks. And we have some state organizations on the line as well as some local communities. Can you talk about some recommendations for first steps for both the state level folks and the community folks for getting hooked in with some of the partnerships that may exist in their states? Like, how do they find out about them? How would you recommend they approach those people, etc.?
Oh, absolutely. I would say reach out to your rural health association in the state. Reach out to your primary care association in the state, and build those connections. Because, like I said, they really have a lot of great resources and tools. And then you meet and connect with other people who are facing some of the same challenges as you are. And so just having that open line of communication and talking about your issues, they might have a solution that you're looking for and vice versa.
This is Julia with Tennessee Rural Partnership. I'm one of the recruitment specialists. Another great option, if you're not already plugged into 3RNet, find out who your state organizational member is. Some states have associate members as well. Those are really great, especially even if you're not doing rural recruitment. If you know who is doing rural recruitment, you can talk to them and see who they're working with, because chances are they're also probably going to be working in the urban underserved, or they know people who are. Honestly, just going to conferences, if you have the resources and time, which I know we all are strapped for, making those connections, networking as much as possible. If you ever think of anything that you could do to work with any local schools, government, honestly, it's any and everything. Don't limit yourself. You never know until you try. So that's kind of how we approach a lot of what we do.
Great, thank you. We are getting a lot of questions about your rural weekend exposure experience. Could you talk to us about that, specifically about how it's funded, as well as kind of dig into some details there about how it works, what do they do while they're there, kind of what does everybody bring to the table, anything like that?
Yeah, so this was something that we kind of decided to do 4 years ago. We wanted to give the residents an opportunity to experience rural for more than just a day. So it was a weekend event that we wanted to plan. And so the first thing we did is we picked out a community in Tennessee that we thought would benefit from bringing these groups of residents to the community, give them a chance to highlight and, like I said before, actively recruit. So that's what we did first, pick the community that we wanted to have the event in. Once we did that, we contacted local officials, we contacted the school system, we contacted the local hospital, the local health department. If there was a community health center, we contacted them, as well as other key stakeholders in that community, just to see what resources they had, because whenever you're planning an event like that, you have to remember, food, lodging, transportation, all of those things. So if you can get a group of people that are actively engaged in that community to help you plan that event, I would say that that's probably one of the key things to look at. And so we actually are the ones who fund that particular event. We pay for the lodging, we pay for the food, and we also reimburse the participants for their travel to and from that community for the weekend. And we encourage them to bring their families because we realize that this decision to go practice in a rural or underserved area is not a singular decision. It affects them and their families, so we encourage them to bring everyone along. And I guess once we get all of that laid out, we make a schedule on, where are they going to go while they're in that community? Are they going to go to the hospital? Are they going to go to the Department of Health? And a lot of times we try to have a variety of rural practice opportunities for them to visit, as well as physicians and other healthcare providers for them to speak with, and also local key leaders in that community to talk to them about, you know, this is what our school system looks like. Here's our bank. This is our local real estate agent. They can help you find a home if you want to come and practice in this community. So it really is a collaborative effort in getting that event off the ground.
What would you say, you know, is the initial feedback from participants? Are they usually like, oh, this is actually a lot, you know, a lot more connected than I thought it would be, or, yep, these are all the same challenges I thought I might have in rural? Kind of what are those initial pushbacks, and how do you kind of overcome that through conversation and experiences?
I would say that a lot of the feedback we get is they're surprised at the experience. It's a lot more pleasant what they thought it was going to be. I think we all can agree on this. There's a misconception when it comes to what rural practice is like. You know, they automatically assume that, okay, I'm going to be in this community. There's not going to be a Walmart. It's going to be it's going to be one stoplight town. And so having them in that community for the weekend and actually seeing people who live there, talking to other physicians who've lived rural, who've practiced rural, it makes it more tangible for them.
Yeah. And of course, you're always going to have the people who participate. We strongly encourage people to be honest. So if that's not something that they want to do, that's a beautiful thing, because then it helps them put themselves on a path towards something they want to do. But if they're kind of on the fence, this is something that we encourage people who don't really know, but they're on the fence. So we hear a little bit of everything, but a lot of times people are surprised about the resources, for sure.
Great. We also have some questions here about the Rural Rotations Program. You know, I think a lot of communities are interested in hosting students or training residents, but the kind of time and money factor gets in the way in terms of lost productivity or just, you know, general time to do it. So can you talk about how your rotations work and how you facilitate that engagement?
Excuse me. This is Denise. I work with Nathalie and Julia. The Rural Rotations Program, we actually have a point person here at TRP who coordinates those rotations, and she works with a variety of sites throughout the state. We're always looking for additional sites. As Nathalie explained, Cheers, that we run with the Primary Care Association is one component of that, and we help them with funding to pay a minimal amount of monies to the preceptors and for travel for the students. Marianne, our point person here, has I think a set honorarium that she gives to the preceptors. We work with them to try to find lodging, and if they need that, or help with mileage. Often the school pitches in with some of that, but not always. So it's kind of on a case-to-case basis, really, what's provided. But overall, we've got somebody out there who's familiar with the sites and the preceptors and knows, you know, how to work with the students at the schools to get these set up.
Great, and you have, you know, some great results listed for your rural exposure through the rotations and through the weekend. Can you talk about the specific touches, you know, quote-unquote touches that you have with students and residents after they go through these experiences with you? Kind of how do you keep in touch with them? How do you keep them engaged through the job searching process? All of that.
Absolutely. The way that we, I guess, keep them organized in the office, we have a system that we use, but that is strictly for organizational purposes. We make sure that we build those personal relationships with them, which means calling them, asking them, you know, once we've sent them a job opportunity, getting feedback from them. You know, did you like this job opportunity that I sent you, or are you looking for something different? So just always keeping in mind to keep that open line of communication. We're not here to just plug in physicians wherever. We really want to find those primary care providers that want to be in those communities and that are going to stay. Because to me personally, you know, it's great to place a doctor in a community, but you're going to be back at square one if they're there for 6 months and they're not happy because you didn't take the time to really understand what it was that they were looking for, and they end up leaving, and that community ends up being in the same place that they were 6 months before when they didn't have a doctor. So we just make sure that we concentrate on communicating with the candidates that we work with and making sure that we're, even once they're placed, calling them every 6 months, or you know, sending birthday cards and asking them, you know, how's the job going? Are you still enjoying your time at this community? Is it what you were looking for?
And after the rural exposure weekends like TRP, we encourage them, strongly encourage them to enter our database, which Nathalie touched on. That way we can see where they are in their process. As a recruiting specialist, we make sure to contact them at least once a year, just check in and say hi. If we're in the neighborhood, just reaching out to them saying, hey, we're going to be in East Tennessee, say to go to ETSU. We let them know that we're going to be there, encourage them to come say hi to us, let us take them out to lunch, things like that. Because we have access to the schools, because they're our partners, we don't have the same kind of restrictions as, say, a pharmaceutical company would back in the day. So we get to have that opportunity to talk to them. And we're in the process now of trying to make sure for our TRP STAR program, we've realized as we've gone on that the pipeline programs that we have are essential to getting those doctors back out and just medical professionals back to the rural communities. If you build them now, then they'll come back to you. So we're in the process now of trying to figure out a best way, which if y'all have any ideas about that, we would love to hear them too, of keeping track of the middle school or high school students who are going out there to see if they do pursue. Because TRP STAR just started in 2013 or 14, it's a fairly new program for us, but we realize that we need to keep track of them too. So we're in the process of figuring out a tracking process for them. But as far as the tracking process for all of our other exposure events that we do, we encourage them to come into our database system. And even if you don't have a database, just having an Excel spreadsheet is a great idea. Having their phone number, if they're in medical school or residency, just having that down so you can touch base with them. It doesn't have to be super complicated or advanced. It can be an Excel spreadsheet, which I use a lot as well too.
Great. What strategies or conversations have you found to be most helpful in kind of overcoming some of those initial barriers or concerns? You know, we talk to a lot of rural health centers who say, well, in our communities, maybe the school system isn't necessarily, you know, what the providers' families are looking for, or, you know, there aren't a lot of job prospects for those partners who are coming into the communities. So can you talk about kind of how you talk to people about that and how you work with your communities through your various processes and partnerships in order to overcome some of those barriers?
Absolutely. I think for us, transparency is the biggest thing. We tell the communities, just be honest. Don't promise the provider something that you can't deliver on just to get them to that community, because once they're there, they'll realize that, okay, well, those resources are obviously not here for me. You know, be honest about your shortcomings and your shortfalls, but also try to highlight the good things that you have. If the school system isn't that great, do you have a homeschooling opportunity, or are there people in the community that homeschool their kids, and you can connect them with that family or those families that homeschool their children. If your spouse, say your spouse is an astrophysicist and there are no jobs for them in that community, are there other options, or is there something else that they could do to feel like they're still a part of that community and integrate them better? It's just thinking outside the box and getting a little creative, but always being honest and always being transparent with that provider and their family.
Great advice, definitely. You know, we have a new question kind of in that vein in terms of when you're having conversations with people and deciding how you're going to attract them there. Can you make any recommendations on salary surveys for rural areas?
Ooh. To be honest with you, there's not, which would be amazing if there is not a super comprehensive survey for rural physicians. Now, the Association of Staff Physician Recruiters, they look at in-house recruiters for hospitals. They have a pretty good survey, and they give you a low to high. And I think the basic one is available. Is it available for free?
You have to participate.
You have to participate in it, but there are definitely surveys out there. I think Rural Health Information, RHI, they have a hub. I think it's rhihub.org or com. They should have some on there, and if not, they love to help and develop those. It's one of those things, you have to look at the community, you have to look at the cost of living, you have to look at the national and be realistic and think about the candidates, especially if you're recruiting physicians who are coming straight out of residency. More and more times they're going to have a lot of debt. But if you're in a rural or underserved community, look and see if you qualify or could qualify as National Health Service Corps site. It's a little bit of work, but that's an additional component if you can offer that. Say you don't have enough, as much money as you would want to attract somebody. If you're registered as a National Health Service Corps site, that's another recruitment tool for you. See if your state has any additional scholarships or loan repayment. Try to find as many of those as you can and include those in your compensation package. Even though you're not directly responsible, that is a way to recruit and attract physicians and clinicians.
Great. And speaking of recruiting and attracting, can you talk about how exactly it is that you source candidates and find a lot of these candidates for your database and develop and, just find people to even start developing these relationships with?
Oh, absolutely. We're fortunate enough. We have a really great relationship with our medical schools in the state. And so we go into the residency programs and talk to the primary care residents about these opportunities that are available to them in rural Tennessee. We also educate them on the resources that are out there for them, state loan repayment and National Health Service Corps loan repayment, because you would think that a lot of the residents would know that these resources to help them pay down their loans are out there for them, but most of them have no clue. And so to go into their residency programs and provide them with that education is great. We also have gone in to talk to them about just different practice types that are located in rural. You can work in a hospital. There are small and rural hospitals in rural Tennessee. You're not just going to be a one-man shop. And so going into the residency programs, that's where we get a majority of our candidates from. We've also expanded, and we do outreach to PA and nurse practitioner students. We go into their programs as well, and we talk to them about opportunities that are available to them in our state. And as well as provide resources like we said, rural rotations, and just keeping that open line of communication and updating them on anything that's going to affect them in their practice. That's probably where I'm going to say 85% of our candidates come from, and then the other half are those that are already practicing but wanting to relocate to a rural or underserved practice.
And we meet those kind of candidates usually at our state level conferences, so like TNAFP, the TPCA conference. That's where we meet a majority of those. And if you don't have the capability of going into your state's residency programs, it is totally okay to reach out to the chief resident, to the program directors, to the program coordinators. Sending them an email, being persistent but don't be overly persistent, just letting them know that if you have an opportunity available, they want their doctors that they're sending out there to find a job. They want to look good. They want to make sure that they can say, hey, look, we've helped place physicians, all of our physicians. That's free. That is totally cool, and that is probably one of the easiest ways to reach out to people if you don't have an in or if you're finding it hard to get into those school programs.
And that's actually, one of the questions we did have on the line here was, there's maybe some initial resistance from the residency programs who hear from a lot of people who all want access to those residents. Can you talk about some of those initial barriers and some specific suggestions for how you can start to really develop those relationships with program directors and chief residents?
Oh yeah, I mean, I think the first thing is just recognizing they are all so very busy, and unfortunately a lot of the times your emails go unread. And so being persistent is key, as well as, you know, calling them and just having a short conversation. You don't want to take up too much of their time, and talk to them about, you know, why your opportunity would be a great opportunity for their residents to go and practice at. If you're just sending them emails that aren't very detail oriented, or just, oh hey, I called you, will you call me back, they're not going to respond. Being persistent, and or honestly maybe dropping by the school to introduce yourself if you have that time or that ability. Just say, hi, I'm so and so, I'm from, you know, this clinic. I just wanted to stop by and introduce myself, and then follow up with an email or follow up with a phone call. That's also a great way to get in with them, because when you have that face-to-face interaction, I think it makes it a little easier to respond back to someone's email.
Another great idea that I heard recently is, what was I about to say? Another great idea is also just to offer, if you can, offer an educational piece, like we do. We do education for the residents about opportunities that are available, different practice types that are available to them. Like Nathalie said, a lot of them don't know about different kind of opportunities you can find throughout the state. Even if it's not about yours, you can offer an educational talk, which then you could get in to talk to the residents. You don't have to reinvent the wheel. You just have to be able to present something that's going to be beneficial. So if you have something that's beneficial for the students and for the program directors and coordinators, that's also a kind of a bonus that could get your foot in the door if you're having a troublesome time getting in to talk to them.
One other thing, excuse me, one other thing I think might be a possibility, we talked about the rural rotations, but find out if that school requires any of their residency programs to have rural rotations, and if they do, offer to be a preceptor site for that program, because that will benefit both the school and you. It's a wonderful recruitment tool to get somebody into your site, to get to know them, to see what kind of provider they might be, and they get to know you, and that can be a long-lasting, long-term relationship in some cases. So I would encourage you to reach out and find out about that opportunity.
Great, and it looks like you know, we have one sort of last question, which is, for a lot of these organizations already, they have limited resources and they're already putting as much as they can into recruitment, but if they were interested in trying some new things with partnerships or some of these rural experiences you're talking about, what would be the top 3 first steps you would tell them to take?
Post on 3RNet. That is free. If you have an opportunity, try to find places like that you can post for free. I know a lot of places, they have some catches with that. 3RNet is not one of them. They are free 100%, and it's great because the candidates who are putting themselves into the system are already sure that they're looking for those kind of opportunities. So number 1, get your name out to 3RNet, because we know resources are very limited for sure.
Mm-hmm. National Health Service Corps also has a job board.
Yes.
So take advantage of that. I think a lot of people don't remember that.
Yeah.
But go in and post your job there as well.
And I would even suggest, if you don't have one already, creating a LinkedIn profile, because a lot of these new residents and medical students have LinkedIn profiles, and they will go and connect with you there, whether you post job opportunities to it or not. It's just another way for you to connect to the primary care providers.
Also, like we said, reach out to those programs. Sending an email is free. Now, it can be time-consuming if you're trying really hard to get into a certain facility, but just reaching out, emailing those, if you can find out who the chief resident is, emailing them, calling them, program directors and program coordinators would be a great next step. What would you say for the last one?
For the last one, just reiterating everything that we've said, collaborate, collaborate, and collaborate some more. You can never have too many partnerships, especially with people who have the same end goal as you do. You're only going to become better when you surround yourself with others that are wanting to make rural healthcare better. So reach out. Don't be scared to just do a cold call and introduce yourself to someone. And those partnerships and collaborations are going to yield results.
Wonderful. Well, thank you so much. We really appreciate your time and your presentation, and we appreciate all of you on the line for joining us in your very busy schedules. We hope you enjoyed today's presentation. Again, the slides are available for download in the handouts box there. We do want you to stay in touch, so please visit our website. If you're not already getting our newsletter, you can sign up for that and be on track to know what the next webinar is going to be. And you have all of the Tennessee Rural Partnerships information in your slide, so please be in contact with them if you want more information about their programs, how you could replicate something similar in your own state. We are going to make this recording as well as the handouts available on our website by the end of the week, so please check back in case you wanted to view or listen to it again. So thank you so much to everybody. We really appreciate your time, and we'll talk to you next month.